All right, we have our last video. It's Mary Gober. It's going to be quick because all Mary Gober has is a sliding scale. We've already showed a sliding scale or how to give a sliding scale on Kathy Devers. So if you need some more information about how to give a sliding scale, go to Kathy Devers. This is considered a correctional dose. We don't need to be concerned about them eating. It's only going to correct the VG that is current right now. So of course, again, following your steps, you're going to review the comp card, log in, look at the medication. We are going to perform hand hygiene before we get going with all of this, just so we don't contaminate any of the vials. We're not even in the patient's room yet. We're outside the patient's room doing this, okay? We're going to gather our supplies. We need Aspart. This isn't Lispro. This is Aspart, which is another fast-acting. So the steps are the same. You just need a different insulin. So you need to make sure that you find that. That probably is going to take me the longest. Mix. This will also probably take you guys the longest, so just make sure. Here it is. Okay. So I'm going to pretend her blood sugar is 370, and her we're going to give it at her 7 a.m. dose. So I know that. That says I'm going to get 10 units based on that. I have this here. I need a syringe. I need alcohol prep. I need a label, just like we did in the others. Okay, I would use a 30. I don't have any 30s left in here. I only have 50, so I can certainly see 10 on a 50, so I'm all good. Cleanse the top of my vial, 15 seconds. Get my syringe open, pull up 10 of air. Make sure you look at the steps too. I might have filled out the label before or after I said on the steps. As long as you fill out the label before you move to your second check and you check your label as part of your first check, you're fine. So I have 10 units of air, go into the side and then up, push it in, pull out, just touching the end of that plunger there. Make sure I can go up and down with this. Make sure I have no bubbles. This. Good. Got this. I'm going to fill out my label. Patient, Aspart, 10 units, date and time. I'm going to make sure that that vial is not expired. Okay. Aspart, 100 units. I'm going to go over here. I'm going to do my checking. I have the correct medication. I have 10 units of correct dose. It's not expired. I'm giving it to Mary Gober. I'm giving it at 7 a.m. Okay, I checked all of those things. Good. I'm ready now to do my second check. Still outside the patient's room. I'm going to check those things again, right? Time, 7 a.m. Route, sub-Q. I'm now 10 units. Medication. I have Aspart. It's not expired. It looks good. Doesn't need to be reconstituted. And then I'm going to give it to Mary Gober. I'm now ready to go inside my patient's room, perform hand hygiene, put on some gloves or wait to put on my gloves until I'm ready to give the injection. Hey, Mary, I'm Shayna. I'm going to give your medication today. I have your rapid acting insulin to cover your blood sugar. Please let me know if you develop any signs or symptoms of hypoglycemia. You're, of course, going to need to verbalize that. Mary, can you tell me your name and date of birth? I'm going to scan, make sure that scans and checks. Of course, I had to make sure I was in the right box to do that. Go down then, make sure I'm in the right box to do my scanning here. I'm going to scan my medication. I'm going to do my third check. Time, route, amount, medication, and patients, right? Now I'm going to put my gloves on, make sure I have my alcohol prep. Your comp card's going to tell you what site to give it in, but as you're practicing, make sure you practice all the different sites. I'm going to have gloves on. Get an appropriate size pair of gloves. I'm going to cleanse that site, 15 seconds. Then I set my alcohol over to the side. That helps me to mark which part I've cleaned. Once I've done that, tell Mary, okay, I'm going to give your injection now. I'm going to hold it like a dart. I'm going to go in that 45 to 90 degree angle. 1, 2, 3. Then I'm going to inject slowly. Of course, remember, no liquid in these. You're going to pull up, and you're going to put that safety on one-handed just like that. going to make sure I monitor my patient. I'm going to, again, with all of these, make sure that I'm verbalizing peak onset and duration. If I miss any of the steps of medication administration, I'm going to be unsuccessful. If I don't verify my patient, if I don't cleanse properly, if I don't wear gloves, if I give the wrong type of insulin, the wrong dosage of insulin, of course, those are all going to be considered failures. If I use the wrong concentration, if I have to mix them together and I don't use the same brand, that's all going to be considered a failure. If I don't know the BG or if the patient needs to eat, that's going to be considered a failure as well. Of course, just let me know if you have any questions.